Hey everybody, it's Matt Shu with Kristen here at Upright Health, and we are continuing our movement tutorials for medical professionals. In this video today we are talking about a movement that has a bad rap. It has a very bad reputation in the medical community for some good reasons, but also due to some misconceptions. So the movement we're talking about today is the deadlift. And the deadlift, in case you're not familiar with it, Kristen is going to show you. It's the way you pick something up off of a floor when it's not super awkward, right? So we have here a kettlebell, and Kristen's going to show you how she's going to pick it up using the deadlift. So you'll notice she keeps her spine pretty straight, and she hinges at her hip joint to get low enough to the floor to pick it up. Only towards the bottom does she bend her knees a little bit to then pick up this object. Now, a lot of times people are told that this is not a good, safe movement for the spine, and instead they're told to pick things up in a different way that is actually not as secure for their spine. So one of the first ways that this goes wrong is with the knee bend. So people are told to really bend, and what happens is this, now you're loading the knees a lot. The knee joints are now going to take a big hit, and a lot of people often end up curling in the upper back when they try to get here because they're trying not to get too low to the weight. So go ahead and stand up. How did that feel?
Not good.
Not good. Now, the reason people get told to lift in that fashion is because a lot of people have tight and weak hamstrings and glute muscles. So, Kristen, can you show this? When you have tight, weak hamstrings and glutes, what happens is you hit a stopping point and your hamstrings say, no, we can't let the pelvis move anymore, and then the spine starts to flex. And this is a terrible position. So if Kristen were going to pick that up at this point, she would have weak links all along her spine because these muscles are no longer keeping the spine in a straight, neutral position. The other method that people use to pick things up that often ends in injury is with a twist. So they go with one hand, and now again the spine is not being stabilized by the muscles, the erectors along the side of the spine, and now you're going asymmetrically loading the spine, and then you yank on it and suddenly your back is out. It's not fun for anybody either. So what we want to focus on with a deadlift is making sure that the spine stays in a super straight position. It maintains its normal curvature, the same curvature that you have when you're standing for the most part. You push your hips back, you keep your knees just slightly bent, and then you use your hamstrings and your glutes back here to pull you up. So this is about using these muscles to help pull the pelvis up. The spine never changes position. So let's see it again. So you see as she goes down, it's the same way to put it down. Her spine stays neutral. She grabs the kettlebell here, and then she lifts up using the hamstrings and glutes to pull the pelvis into this direction. Spine stays neutral the whole time. Okay, so if you have a patient who has trouble even achieving just this motion, then you're going to want to have them stretching their hamstrings for sure as a primary objective. So an easy hamstring stretch, we can use this bench here. We're just going to have Kristen put her foot up like this, pull the toes back, and then make sure that the knee goes straight. So she should start feeling that stretch all back here. Now, if we want to adjust this stretch, we can have her do some little twisting. So she could twist her chest to point towards you. That'll give an extra stretch on the lateral hamstrings. If that's not enough, as you can see, she can go ahead and lean a little more into it. What you'll notice she's not doing is curling her spine. The objective is to stretch the actual muscles and not achieve touching the toes, right? We're just trying to get these muscles to relax more so that this motion becomes possible. All right, and go ahead and relax. So that's one simple thing you can do that you can show your patients to help them achieve better deadlifting motion so that they can do that without hurting themselves. So I hope that gives you some ideas and that helps you out with your patients, and I hope you remember that pain sucks.
I shouldn't.
People will often let their heels come up off of the floor while they go to squat, which loads their knees